Welcome to Preop Preparation, getting ready for your bariatric bypass surgery. This video is brought to you by BariatricFoodDirect.com, your source for discount pricing on bariatric food and supplies. For many, bariatric bypass surgery is a life-saving procedure. You may even know someone that has gone through the procedure in part because their health was in jeopardy. It's used for one simple reason: you will lose weight. In the coming months after your surgery, your body will feel better, you'll look better, and you'll be well on your way to overcoming a very difficult setback. But in the long term, you'll have to change one very important element that has brought you on this path. You'll have to change your diet. This video is going to help you prepare for what's ahead and show you some of the options that are available. Proper preparation can help save you pain and disappointment, both mentally and physically. Let's take a look at comorbidities. Comorbidity is a disease that you suffer from that is directly related to morbid obesity. And what defines morbid obesity? Well, you've probably heard about BMI, stands for Body Mass Index. It uses your height and your weight and sometimes your gender and age to calculate your BMI score. Now, a BMI score over 35 is considered morbidly obese. And in some cases, as in some insurance agencies, you're considered morbidly obese if you're 100 pounds over your ideal BMI weight. Let's take a look at some of the examples of the diseases that can be caused. These are comorbidities that can be caused from being morbidly obese. So we're looking at arthritis, sleep apnea, high blood pressure, high cholesterol, type 2 diabetes, and of course, a whole lot more. You could include depression, stroke, congestive heart failure. The list just goes on and on. These are diseases that are more than often directly related to one common problem: obesity. And you know all of this already, I'm sure. That's why you're getting the surgery, and that's why you're watching this video. Our job here is to help prepare you for that surgery and provide you with the best information and products that'll help you get the best results from that surgery, and hopefully just make the whole process a little easier. So let's take a look at an overview of what you've got to look forward to in the coming days, weeks, and months. Like I mentioned before, in order for this to work, you will have to change your diet. And I'm going to be blunt with you right now. The road ahead isn't going to be an easy one. You've probably developed bad eating habits over your lifetime, and those are going to have to change. But the information I'm about to give you can help you make a smooth transition and, most importantly, help you stick it out and get the results you're looking for. At this point, you're looking at a lifestyle change, okay? And I need you to take it very seriously. We're going to look at the Preop liquid diet that you'll need to be on for 7 to 14 days. We'll look at what to do immediately after your surgery and for the first week. And then we'll break things down to weeks 2 and 3, weeks 4 and 5. All of these are just different phases where your diet is going to be adjusted as your body attempts to get back on track. And then we'll end up with phase 4, which is week 6 typically. You're going to resume eating normal food and, again, begin a lifelong journey of good eating habits. Lastly, I'll show you where you can get the products that you're going to need to help you attain your goals, meet your nutritional needs, and also satisfy, any urges and cravings that you might experience. So first up, let's take a look at your pre-op liquid diet. In order to perform the surgery safely, your doctor is going to want your liver and your spleen to have as little fat around them as possible. Okay, so the liquid diet will help to reduce the amount of fat that is currently surrounding those organs. You're going to be on this diet for 7 to 14 days, depending on your doctor's instructions. Follow the diet to the letter. You cannot cheat, because if your organs don't lose enough fat, your doctor might cancel the surgery, and they could even cancel it in the middle of the procedure if the doctor discovers that the excess fat is just too risky. Trust me, you don't want to have waited months for this surgery and then get it canceled on the operating table. Protein shakes. This is what most of your meals are going to consist of during this pre-op phase. No beverages with sugar in them. That sugar is going to prevent your body from using up the fat around your organs. Sugar substitutes are okay, so you can look for beverages with natural sweeteners like stevia. Absolutely no caffeinated or carbonated beverages. No sodas, even diet. No coffee, except for decaf, obviously. You can have soups, but make sure it's only the broth. No noodles, no potatoes, no meat, just broth. You can have very thin cream of wheat. Juices like V8 juice are fine, fantastic. That's very good for you. Sugar-free Jell-O is a great way to get some additional flavor and give you a kind of a texture, other than just drinking liquid, because, being on liquids for 7 to 14 days can be tough. So you're going to want something other than, just a drink. You're going to want to sip your beverages very, very slowly. Don't mix your protein shakes with other beverages. After, a meal of broth or a protein shake, you're actually going to want to wait 30 minutes before drinking a beverage, including any juice. So you're consuming your protein shake, wait 30 minutes before you even have a glass of water. After your surgery, you're going to need to separate your meals from your beverages throughout the day. And you want to start doing that right now before the surgery. Remember, you're going to be doing this for 7 to 14 days. My suggestion is to mix things up, give yourself some variety, create a plan, and stick to that plan. Bariatricfooddirect.com has ready-to-go pre-op kits that will supply you with everything you need for 7 days on this pre-op diet. And I'll tell you a little bit more about that at the end of this video. So let's take a look at a typical meal schedule for your pre-op phase. You can mix things up, but you're going to want to follow a plan that's very similar to this one right here. Okay, what you're going to notice right away is you're only consuming one item at a time, and they're an hour apart, and this is very, very important. Using this strategy is going to help your body burn up that fat around your organs, but at the same time, sustaining your core. You don't want to feel miserable during this whole ordeal, and believe me, that's going to be very difficult to attain. So you want to stick to a meal plan like this. In this example, we're starting here at 8 o'clock in the morning. Obviously, you can adjust your schedule accordingly. But in this example, we start with a protein meal replacement. That can be a protein shake. And then an hour later, 8 ounces of skim milk. And then an hour after that, 8 ounces of water. Okay, that proceeds throughout the day. Every hour you're consuming certain types of items. And don't think that you're going to get better results by skipping a meal entirely, or, I'm not thirsty, so I'm not going to drink my water. Don't do that. Don't try to cheat, early on in the diet and think that you're going to make up for it by cutting your consumption later on. It will not work. In order to get the results that you need for your surgery, you want to stick to this path very faithfully. Obviously, you can adjust your eating times, like I mentioned, around your schedule. If you get up early or get up later, whatever. It's just important that you have 12 hours of consuming liquids and doing so every hour. Eating like this is going to put your body into a state of ketosis, where your metabolism is much higher than normal. Your body is going to be burning fat at a much higher rate than normal. And at the end of this video, I'm going to tell you about some of the great high-protein meal replacements options that we carry at Bariatric Food Direct. So let's look at before the surgery, going into the surgery. What kind of things do you need to prepare for? A lot of times people don't do this planning, and then they end up at the hospital and they don't have things that they absolutely do need. So are there any medications that you should stop taking before the surgery? If you've followed your high-protein liquid diet faithfully for 7 to 14 days, you're going to be ready for that surgery. You need to ask your doctor if you should stop taking any of your medications prior to surgery. Don't just assume that they know every medication that you're on, and don't assume that they have even, given it that thought, because Coumadin, steroids, even aspirin or Advil can cause you problems. If you're on birth control or using replacement hormones, your doctor needs to know this, and they're going to decide if it's safe to continue using those throughout your procedure. If you have sleep apnea, bring your CPAP machine to the hospital. You're going to want to get some vitamins and supplements before you go into the operating room. That way, when you get home for your recovery, you've got everything that you need right there, and you don't have to endure trips to the store or wait for shipping on products that you possibly cannot find locally, or at least it'll be quite an ordeal for you. So in other words, you want to go to your surgery, and when you do get released, you want to come home and everything you need is already there. You don't want to go on a shopping trip after that. If you smoke, now is the time to quit, and do not play with this, guys. If you smoke, smokers have an increased risk of blood clots and complications during and after surgery. Ideally, you're going to want to quit before you even start your liquid diet, because your body is going to be experiencing extra stress, and it's not a good idea to heap one stress on another by attempting to quit while you're going through this very difficult process. So it's kind of like two withdrawals. You're going to have sugar withdrawals. You're going to have just the low amount of calories that you're going to be consuming. Okay, and then you're going to heap on that also quitting smoking. It's going to be very, very difficult. So try to quit smoking before you even start that liquid diet. And remember, with smoking, if you can make it to day 10, man, make it to day 10. Then you'll be good to go as far as physical symptoms. You want to avoid any meals or liquids after midnight the night before your surgery. Keep an empty stomach, or again, that surgery could be canceled even on the operating table. So if your surgery is at 10 a.m. in the morning or 8 a.m. in the morning, whatever, midnight the night before, nothing after that. So take the time to prepare for the coming operation, and that will help ensure success. You and your doctor are a team. If you do your part, it's going to help your doctor do theirs. And remember, everything that we say to you here, this is just helpful information. Always follow your doctor's guidelines. Now let's take a look at post-op and the healing process. In as much as proper preparation before your surgery is necessary, it's just as important to prepare after surgery. Each week, your body's going to be healing, adapting, reconfiguring, and in general, putting you through a very difficult time. You're going to have to adhere to a very strict eating plan in order to avoid complications and sickness. Here's the 4 phases that you're going to go through. Your body, again, after surgery is almost going to be in a state of shock. It needs to heal. Basically, it's going to be like your digestive system has just shut down. Your stomach's going to have a staple in it. That needs to heal. It'll be a whole lot smaller. Its ability to digest food is going to be severely hampered. You'll slowly start to introduce your stomach to food, but you have to do it very, very carefully. We're going to cover each one of these phases in more detail, but just as an overview. Phase 1 is clear liquids only. You're going to follow this regimen for 1 to 7 days. You're going to drink only 1 to 2 ounces per hour. Your dietitian is typically going to recommend things like water, fat-free milk, fat-free broth, and sugar-free Jell-O. Important that you stay away from sugars. Again, we're looking at post-op phases. This is after your surgery. For 1 to 7 days, clear liquids, and then you're going to move on to phase 2. That adds pureed foods into your diet. You're going to start introducing liquefied protein back into your diet. Typically, you're going to be on phase 2 for 2 to 3 weeks after surgery. Again, this is just an overview, so don't worry. We're going to deal with each one of these phases in much more detail in the coming moments. Phase 3 allows for soft foods, things that you can easily mash with a fork, like fish, lean chicken, egg whites, that sort of thing. That phase, again, typically lasts 1 to 2 weeks. Then you're going to move on to phase 4, where you embrace your new diet fully. You're going to be allowed to eat regular food. You still don't eat whatever you want, and you'll have to take it slow. But making some changes that you can live with happily for the rest of your life is what we'd like to help with. So let's get started with phase 1 of your post-op diet. I want to stress, always follow your doctor's guidelines. The information we're providing here is just that. It's information. It's so that you know what to expect. Your doctor, though, knows your specific situation, and you should always follow their recommendations. For phase 1, you're going to have mostly water, 1 to 2 ounces per hour. Perhaps once a day you'll have 1 to 2 ounces of fat-free milk, 1 to 2 ounces of sugar-free Jell-O, and 1 to 2 ounces of fat-free broth. Spread that throughout the day. You're going to drink 1 to 2 ounces per hour. And you're not going to mix things up. You're only drinking one kind of thing per hour. Let's take a look at a sample schedule. And it's important that you stay hydrated in this phase. And believe it or not, 1 to 2 ounces of water might make you feel uncomfortably full. Right now, you wouldn't believe that. But after this surgery, it's going to be difficult to even drink a lot. You're going to want to drink very, very slowly, sipping bits at a time. Do not use a straw because that can introduce unwanted air into your stomach. And at this point, that's something you definitely don't want to be dealing with. Some doctors are going to introduce possibly some protein shakes a few days into phase 1. So, remember, just keep following your doctor's guidelines. The key is that every hour you're drinking some water. At noon, you might have 1 to 2 ounces of fat-free milk. At 3 p.m., 1 to 2 ounces of sugar-free Jell-O. Then at 6, 1 to 2 ounces of fat-free broth. Each hour and between, though, you're drinking water. Keep your exertion down. At this point, you can't afford to overwork your body. You can start a mild exercise routine in phase 2, which is coming up. But at this point, remember, your body's just getting used to this, and you're not consuming a lot of calories at all. So you can't really afford to overexert yourself. Phase 2, because your stomach is going to be so much smaller, you're going to need to eat smaller meals with more frequency than you're probably used to. This phase is going to last 2 to 3 weeks. And you've got, for that 2 to 3 weeks, you've got some dietary requirements. In other words, you need to meet certain goals for what you're eating so that your body can stay nutritionally sound. Every day, you're going to consume 60 to 70 grams of protein, 64 ounces of clear liquids, and that means, when I say clear liquids, that is clear liquids as defined in phase 1. So it could be, for example, chicken broth. No caffeinated or carbonated beverages. Avoid refined sugars pretty much anything with sugar in it. You want protein that's going to be easy to digest. Protein shakes, egg whites, non-fat soft cheese, non-fat cottage cheese. You're going to puree that with water or fat-free milk or fat-free broth. Now, very important, phase 2 involves pureed foods. Any of the food that you eat is going to be blended with water, fat-free milk, or fat-free broth. Also, you cannot count any of the water or broth that you use to puree your food. You cannot count that towards the 64 ounces of cleared liquids. Those are 64 ounces of cleared liquids that have to be consumed separately from your meals. As a general rule, you're not going to consume any of the clear liquids for 30 minutes before a meal and for 60 minutes after a meal. So, for example, if you have 4 ounces of water, you're going to need to wait 30 minutes before you have a pureed meal. After you have that meal, you're going to wait 60 minutes before having another drink of clear liquids. Let's look at a sample phase 2 schedule. Your phase 2 meal schedule might look something like this. You're going to start your day with a protein shake and a multivitamin. So we've added something in to your routine. At 9 a.m., you drink 8 ounces of water. At 10 a.m., 2 egg whites pureed. And then at 11 a.m., you're going to have an 8-ounce glass of milk and a calcium supplement. Now, you want calcium citrate. Write that down. This is very important. You want 2 to 3 doses per day, each between 400 and 600 milligrams. Now, one thing I want to mention, you need to keep your calcium and your multivitamin doses separated by at least 2 hours, because multivitamins usually contain iron and that can interfere with calcium absorption. So that's why we've got in this example a multivitamin at 8, and then 3 hours later is where the calcium comes in. Again, 3 hours later, another multivitamin. Okay, here we've got a window of 2 hours. That's your minimum. All right, now phase 3, this is soft foods. This has to be a very gradual introduction. It typically lasts 1 to 2 weeks. You're going to consume 60 to 70 ounces of protein per day. You'll continue to drink your 64 ounces of fluids. Your serving size is going to be 1 to 2 ounces, and you're going to eat 3 to 6 small meals per day. Don't force it. When you're feeling full, stop. If you try to push it, if you try to make yourself eat more, you're going to regret it, guaranteed. You're going to add a vitamin D supplement as well into your mix. Okay? What kind of stuff can we eat on phase 3? You want low-fat, low-calorie starches, fruits, cooked vegetables, that sort of thing. Soft meats are even a candidate. Anything that you can mash, really. So lean meats like chicken, turkey, and fish. Here's some dairy that you can consume. Tofu, vegetables. Again, foods that you can smash, okay, with a fork. Your body's going through an adaptive process here. Don't force things down that aren't agreeing with your stomach. And you want to chew your food very thoroughly. Avoid breads, avoid skins, seeds, the seeds on fruits and vegetables. Try to avoid those. No drinks, again, 30 minutes prior to your meal. This time, wait at least 30 minutes after your meal before you have a drink. As far as the meats go, fish, turkey, chicken, make sure they're finely chopped. Hard-boiled eggs, poached eggs, soups, hot cereals, baked potatoes, sweet potatoes, yams, boiled pasta, noodles, white rice is okay. You can have canned fruit if it's in its own juice or water. Bananas are good, cooked or canned vegetables. Avoid raw vegetables like broccoli, because they're going to be a little bit difficult at this phase to digest. Bariatricfooddirect.com has some great products to help supplement your phase 3 dietary requirements. You're going to see those on our website, and I'll have some links below the video. If you have any fat at this phase, you're probably going to want that to come from something like an avocado. All right, here's a typical phase 3 meal schedule. And you can see we've added our calcium, we've added vitamin D, and a dose of sublingual B12. This is going to be 500 to 1,000 micrograms, not milligrams. For the vitamin D, we recommend 1,000 IU of vitamin D3 per day. Okay, you can split that up like here into 2 doses of 500 IU. Once you've completed phase 3, again, this is going to take 1 to 2 weeks, your doctor will have you start eating real food, and that means we're ready for phase 4. Phase 4 is where you return to solid foods. You've come a long way. You're going to be rewarded with great results, no doubt. But now you want to get your body to accept regular food, and you need to control what and when you eat so that you get the results you're looking for. This is a lifestyle change. The diet you're going to be on will consist of proteins, vegetables, limited grains, very little sugar. You're going to follow this diet for the rest of your life. For health reasons, believe me, you want to stick to this diet. Don't worry, though. Bariatricfooddirect.com provides food that will meet your requirements and help you enjoy your food and satisfy your cravings. For men, 60 to 70 grams of protein a day. For women, 50 to 60 grams. And to meet those needs, to meet those requirements, you might have to even have a low-calorie protein food between your meals. Make sure you eat slowly, chew your food every single bite. Take 10 to 15 seconds of chewing your food before you swallow. That aids in proper digestion. You're going to reintroduce one new food at a time. And ideally, you do that new food, one new food per day. This is to give your body a chance to react. You might not be able to stomach certain foods, even foods that you have previously eaten and enjoyed. If you try more than one new food and you do have a problem, you're not going to know which food caused the problem. So one new food at a time per day. Just like before, you're going to consume food and water apart from each other at least 30 minutes. So separate your beverages from your food 30 minutes apart. Continue to drink at least 64 ounces of water per day. Obviously, more if you exercise and sweat that away. At a typical meal, which should be rich in protein and vegetables, eat the proteins first, followed by the vegetables, and then any carbs. So if you're sitting down to a meal of steak, rice, and broccoli, you eat the steak first, followed by the broccoli, then lastly, the rice. You're looking for foods high in protein, low in carbs. Read the labels on everything that you buy. What you're going for is a 10-to-1 ratio of protein to carbohydrates. A simple technique to see if a food meets your requirements is to just add a 0 to the grams of protein. If the carbs is more than that, consider another food option. Now let's talk about dumping syndrome. Dumping syndrome is when sweet or fatty foods have been eaten too quickly, or you've just eaten too much of them. What happens is your stomach just dumps the food into your small intestine, even though it hasn't had proper time and been able to digest that food, really breaking it down and getting it ready for digestion. This can cause nausea, cramping, sweating, vomiting, diarrhea, and increased heart rate. This is not a comfortable situation. Okay, I advise you take this very seriously. I know several people. My mother had this very operation and failed to heed this advice And to hear her describe it, believe me, you don't want to go through it. Eat your food slowly. Chew it very, very thoroughly. It lasts typically 1 to 2 hours. And again, that's 1 to 2 hours of being incredibly uncomfortable. Avoid foods that are high in sugar and refined carbs. Some of the foods that can be difficult to digest include beef, pork, shellfish, grapes, nuts, whole grains, corn, and beans. You're following similar guidelines here to your phase 3 meal requirements. And that means the protein, the vitamin supplements that you're going to take, and the amount of water that you need. You can start adding a greater variety of fruits and vegetables. Again, introduce them slowly, one at a time, until you're confident that they're not going to cause you any problems. You can have a very small amount of fat, a very, very small amount of sugar. Again, be careful with that. If you like, you can also introduce caffeinated and carbonated beverages. Again, slowly. Don't, go overboard with them. Take it easy. Your target here is going to be about 800 to 1,500 calories per day. All right, here's a sample phase 4 meal schedule. Remember, though, this is just a sample. You can mix things up, just, kind of get the whole gist of it and the layout, the design, and make sure that you meet those requirements. You've got your protein goals to consider, water consumption, and your supplements. Okay. Your supplements play a very important role in your diet post-op. They're more important now than they were even before your surgery. Don't forget, though, you can download meal schedules here at bariatricfooddirect.com, and that'll help you meet those requirements. Now, let's discuss the other aspect of attaining your goals and keeping your body in great shape, and that is exercise. Immediately after surgery, do not lift anything over 10 pounds. That could rip your stitches and cause a hernia. So for phase 1, basically you need to be resting and recuperating. At phase 2, you can start moderate exercise. The key here is 30 minutes of exercise 5 to 7 times per week. That can be walking, running, riding a bike, or you can go to the gym, okay? But just find something that you enjoy doing and stick to it. Kayaking, tennis, racquetball, anything that'll get you moving, get your blood pumping a little bit, and get you breathing a little more intensely. Now, to recap, during your pre-op liquid diet phase, you're going to need to consume some high-protein meal replacements. These are very important. You need more protein than carbs. You've got to provide your body with the necessary nutrients to sustain daily function, but at the same time, helping your body reduce the level of fats. These replacements, again, high in protein, fewer grams of carbs than of protein. It's very simple. Bariatricfooddirect.com has great products. In particular, there's a shake available in 3 different flavors: chocolate, strawberry, and vanilla. They taste good. Each serving gives you a large portion of the recommended daily allowance of vitamins and minerals. The shakes will give you 35 grams of protein and only 21 to 22 grams of carbs, depending on the flavor that you select. Go to bariatricfooddirect.com. Click on Meal Replacements on the left sidebar menu. You'll be glad to know that we also provide these meal replacements in a pre-op liquid diet kit. Check out our post-op meals and supplements. We've selected products that meet your nutritional requirements and will also give you some variety and help satisfy your cravings. Thanks for watching, and on behalf of bariatricfooddirect.com, we wish you the best results with your gastric bypass surgery.